Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Okay, still Smooth 90.1. Welcome, of course, to Smooth Health, and it's brought to you courtesy of Evercare Hospital, they're situated in Lekki. And today's conversation will be a commemoration of World Cancer Day. We'll be discussing the symptoms and treatment options, and to guide us to this. In this conversation, we're going to be joined by the one and only Dr. Uchenna Okoro. How are you doing, sir?
I'm fine.
You're fine. Now, that is a radio voice. That is a radio voice there.
Thank you.
You're competing with me. Come on. I like that. Now, Dr. Uchenna Okoro is a consultant clinical and radiator oncologist. If you don't know what an oncologist does, they have to do with cancer and all that, and diagnosing and all of that, right? And the core specialties, of course, is the malign, when you check the malignancies of the breast. This medical, it's not a musical track that I'm trying to. You need to read all this out.
I understand. So it's malignancies of the breasts, genitourinary tract, gastrointestinal tract, GI, gynecological tumors, and prostate malignancy, all the works, head and neck. So it's practically every region of the body.
Is your handwriting as good as your voice?
I hope.
No, because
I don't know which is better.
Because doctors, when they write and they sign like this, is like, you don't know, you just learn, like, it just seems to be like one line, like something like that, going left field or right field, only heaven knows. But anyway, I mean, welcome to the show, and we're going to be asking you a few questions with regards World Cancer Day. Now, Dr. Okoro has attended several training courses, including a United States Embassy-sponsored upgrade medical oncology course in 2018, as well as an immunology oncology internship at HCG Cancer Center in Bangalore in India. He's experienced in several radiation therapy delivery platforms like Varian Eclipse, Varian Aria, Electa Monaco, as well as in brachytherapy. He also attended several conferences and workshops, both locally and internationally. So, Dr. Okoro, please tell us, what is cancer? What is cancer?
Thanks for the question. Cancer basically means an abnormal proliferation, that's growth of cells. These cells initially were normal, and all of a sudden they become abnormal, and they begin to grow in that path. They progress to form tumors, and eventually would result in what we would refer as a cancer.
But what are the causes of cancer? Because people start to wonder, I'm healthy today, tomorrow they say...
When it comes to cancer and its causes, we would like to answer the question by just talking about risk factors, because really it's very difficult to pinpoint causes of cancer, except in cases like cervical cancer, where about 97% of those cancers, or up to 98%, is caused by the HPV virus. In terms of risk factors, age is one of them. So the older you get, the higher the chances.
You're more susceptible to
it. Exactly. Even though there are malignancies that we see more in the childhood, pediatric ages. Lifestyle, which would include certain habits, smoking, alcohol, excessive alcohol intake. There are also genetic factors. So there are some malignancies that unfortunately may run in some families.
Some families and transferred.
Environmental factors, smoke, asbestos, a lot of factors. There are some that we can do something about. I mean, you can't do anything about your age, and there are those that...
I tell you what, some people are preserved, they're trying to stop age from moving. I don't know.
I wish them all the best.
No, with AI and all these things, you never know what these people are.
Exactly.
Yes, consciousness and all those talk. Anyway, what are the signs and symptoms of cancer in a person?
signs and symptoms of cancer are not, we have what we will call generalized symptoms, the ones that can happen even when you don't have cancer and when you don't know where the cancer is coming from, like weight loss, undue fatigue, reduced appetite, and just general feeling of unwell. Then when you come to organ specific, so unexplained, progressively worsening headaches could be a sign of maybe a brain tumor. You could have maybe bloating abdomen, where you have your abdomen always full and it's continuously distending, increasing. That may just mean something happening there. Prolonged constipation, or when you have maybe tumors of the eye, would definitely cause you some degree of reduction in your peripheral vision. Yes, so those, there would be organ specific, and there would just be the general ones. Yes.
Now the thing is, a lot of people are going to be listening to what you're saying, and when you mention one or two, there's something like they jump in their chair like, oh please. But I mean, with a voice of yours, I'm sure you probably have a common effect on your patients.
I hope so.
You hope so. All right then. And I mean, as the various types of cancer, but how can we identify them?
I mean, the first thing is to be able to listen to your body. In most cases, when you begin to have a symptom, maybe pain, and it has prolonged itself, it's been there for a while, and despite using painkillers and all, and it still continues, or maybe when you have some other symptom and you're not urinating very well, you're not using the bathroom very well, these are things that you should look out for. So if you have that health-seeking habit, then you will be able to have an idea that something is wrong. And the best way to know is to go to the hospital. When you get to the hospital, of course, you're going to have a physical exam, probably follow up with some lab tests. Imaging is very important as well, especially in the field of cancer treatment and diagnosis. So the physician putting all this together would be able to tell you whether or not he thinks you might have a condition that is related to cancer. And if that's the case, if it's something as obvious as maybe a breast lump or a breast mass, then a biopsy would be done and sent to the lab for processing, and that way you'll be able to, the clinician is able to make a diagnosis. Yeah,
I see. Incredible stuff with us, and I'm hoping that we can actually find out what's wrong when all these diagnoses actually happen. What we're going to do, we're going to take a little bit of a break, and then when we come back, of course, we'll continue with you, my good sir, right here on, of course, Smooth Health. Stay with us.
With good love, baby. Let me fill your heart with good times. Make memories in the name of love. Oh, yeah. Said all these things good love can bring. My promise to you, you keep your promise to me. Devoted to you, girls, and my heart will never change. So I need you to show me that you love me just the same. I would know. Oh, yeah. Baby, I need it. Girl, I want your love, baby. And all those years, yeah. Baby, I need it. Girl, I want your love, baby. I vow to love you forever. I vow to hold.
Smooth Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Okay, still Smooth 90.1, and we're back on, of course, Smooth Health, which is brought to you by Evercare, and we have with us in the studio Dr. Uchenna Okoro, and we're talking about cancer and all the related types of cancer and how to treat and all that. And talking about treatment, what are the treatment options for a cancer patient?
Yeah, good question. Treatment options for cancer I would like to break it down into stages. So early when cancer stage as an early disease, usually surgery is advocated for patients like this. But when you have disease that is a bit what we would call locally advanced, so you have from maybe stage 2, late stage 2 to up to a stage 3 and a stage 4, such patients would require radiotherapy. I mean, chemotherapy, yeah, and radiotherapy as well. However, with, recent advances in medicine, we're looking at newer treatment options like targeted therapy, which, it's a bit more molecular and highly advanced. And there's also immunotherapy. There's other branches of radiation therapy that are coming up, brachytherapy, different treatment deliveries. So options in cancer treatment it's expanding. It's not just maybe surgery, what we were used to many years ago. So chemotherapy, which is getting better, and immunotherapy, like I mentioned, targeted therapy, radiation therapy, very important, these days. And with the advent of newer ways of getting it done, side effects and all in most of these treatment options are getting much better. Yeah,
a lot minimal.
Yeah,
and that's what people want to hear, because people are always scared of things like chemotherapy,
yes,
and all that, because of the levels of radiation and all that.
Chemotherapy, yes, it's not an everyday treatment modality, but I believe in the right hands it's safe enough. Radiation therapy, yes, the same. So it's all about where you're getting your treatment from, and
how good is people
how good, yeah, exactly,
administering the treatment as well.
Absolutely.
Okay, now, is there a cure for cancer?
Early detection is key. So if a patient is able to identify a problem and that problem appears to be malignant and the disease is described as early, yes, that person, a cure is possible. But unfortunately, due to a lot of factors, social, cultural, it's a bit difficult for us to find diseases in their early stages. We are used to finding diseases more in late presentation. So when they come at that point, a cure is not usually feasible. So you have to find a way of managing the disease and possibly offer palliative care if a disease is not curable. But a cure is possible, yes. A lot of malignancies can be cured.
Okay, yes. That's good. I mean, what else, plays a part in, people getting cancer? You talk about lifestyle and all that. But how does, diet and nutrition, food and physical activities affect the management and prevention of cancer?
A very important question. What we eat has a lot to do with our ability to reduce the risk of malignancy. So if you're on a very healthy diet, healthy means you are not always taking processed food, you're always doing a lot of vegetables,
exercise,
a lot of vegetables, and you take out time to do a lot of physical exercise, yes, the risk of malignancies will reduce. It doesn't mean that someone that eats all that and does all the exercises, it's not going to, but the risk is much reduced for those in that group. And it's reverse. If you are one that is always used to junk and you don't exercise, sedentary lifestyle and all, you might just be putting yourself at risk of certain diseases like malignancies and cardiovascular diseases and all of that. So
interesting stuff. Now, tomorrow, Friday the 4th, is World Cancer Day. Now, this year's theme is Close the Care Gap, which highlights the importance of access to health care for everyone. Now, can you tell us what should our listeners know to better understand cancer and also take action this year?
We have already talked about some of the risk factors that may be responsible for cancer. So I think if there's one message anyone would want to take away from this talk today would be be a bit more health conscious. It is always easy for us to have parties, invite friends whenever we want to, celebrate achievements in life. At the same time, there's nothing wrong if I decide to, this year for my birthday, I'm going to give myself a health check. Yeah, just go to the hospital and get yourself checked. It's as simple as that. That singular act may just be responsible, you having another 15 years of having 15 more birthdays. So it's something that I don't think you mustn't do, some very expensive investigations. Just a simple walk-in to have someone examine you, the things you can do at home for ladies, self-breast examination and all of that. It really helps. For the World Cancer Day, there is a huge gap in access to care between the Western civilized world, as they would call them, and those of us that fall into the developing countries. So the theme for this year's World Cancer Day, just like you rightly said, is trying to close this care gap. So we're calling on government and relevant agencies to do what it takes, international donor organizations, to say, hey, we are seeing that there's a lot of progress going on in the cancer space, which is evident in the declining numbers of cancer deaths in advanced countries. So some of that technology should be transferred, whether it's in form of trainings, medications. Something needs to be done. I know the federal government is trying. At least most recently, we have the National Health Fund now, and there is this talk about taxing beverages and things, about 1% tax on them to fund the health fund. It's a good initiative. So if part of that fund is channeled into cancer research, cancer treatment, especially for the indigent, after all, most of this consumption of some of these substances are actually risk factors for the development of cancer. So it's only fair that part of the proceeds from that tax should make their way to cancer research and funding, training, treatment, especially for the indigent ones.
Now, this is something that I thought of while you're talking about this, and there are a lot of companies that manufacture food and whatever, and they have now been mandated to actually, on the tin or on the can or whatever it is that they're producing, to actually let people know what is inside the can in terms of the chemicals that they've used to preserve. Do you think that's going to work?
It's been tried with cigarettes, and I don't know how much that has helped. Even up to the point of drawing, some very,
skull and bone.
But it didn't stop. At least to a reasonable extent, it did not stop. So, as much as you're going to have people wanting these products, you should be able to tax, the profits made from this to, help those that are going to have health challenges as a result of consumption of this. It's only fair that this happens.
Okay, we have a question from Dio, who is from Ikorodu, and it goes, can you please, doctor, shed light on perfumes, colognes, body sprays that they said is also increasing the risk of cancer?
Good question, Dio. It would be more of what is the contents of the perfume and the cologne. So if there are materials that, even though aerosol, can actually predispose to malignancy. So I don't know what is contained in the perfume or the aerosol you're trying to make reference to.
I hope that you're not trying to scare us from wearing perfume.
No,
I like to smell good. I love to smell good, Dio.
So if the perfume you're referring to probably has some materials that are labeled as carcinogenic, that means having ability to cause cancer, then it's a cause for concern. I would advise against using such products.
Okay, so I think someone said something, maybe it has to do with what I said. It goes, the legibility that typifies the handwriting of a man or doctor is driven by the speed of thought. Oh, God. That is, what did they call it? Graphological explanation. Oh, wow. Thank you very much indeed. We learn every day. We learn every day, yes. And it's Dikpo, what it says? Dikpo Mark job, Dr. White, or the Dr. Wright. Thank you very much indeed. Anyway, we have very, very intelligent listeners who just come with something that's going to make you rack your brain. So we've been talking to Dr. Uchenna Okoro with regards cancer, and it's World Cancer Day tomorrow as well. So I'm sure a lot of people, I don't know if people actually have something that they wear to depict World Cancer Day, like a ribbon or something like that. And I don't know, but I know that breast cancer is a pink ribbon that they wear and all that, so that people are at least aware. That I don't know how much awareness has been made, in the country with regards to World Cancer Day. Is Evercare at the forefront of that?
Yes, most definitely. Awareness generally, it's on the upbeat. I know a couple of years ago it was really hard getting this information out, but thanks to outlets like Smooth FM, we're able to tell our listeners that, hey, look, we have a problem, almost getting to pandemic levels, but there's something that can be done. So Evercare in-house, we always promote health-seeking habits for our clients when they come to the door. As much as possible, we try to, talk to them about things that they can do at home to reduce this risk. We encourage our patients, not just our patients, anyone that comes through the door, anyone that, wants to find out what we do to take their health very seriously. We have various packages in the wellness clinic where we encourage people to come in and do tests, investigations. You don't have to begin to experience symptoms before you come to the hospital to get checked. You can just walk in. I just need to get checked. That's why it's called a wellness clinic. Okay. You just come in to get checked, and if for any reason
at a nominal charge, I guess.
Yes, it's actually quite affordable. Okay. I must say it's quite affordable. I mean, you're just coming to get checked. It's not as if you're being charged for a treatment. It's just a physical exam may just be enough to pick up something, and I mean that shouldn't cost you too much.
Not an arm and a leg.
Yes.
Exactly. Okay. And I was hoping if there's anyone out there who wants to ask Dr. Uchenna Okoro a question, the number to actually send your question to is 0809-444-0981. When some of you, let's see now, I think someone wants to ask a question. Oh, of course, I don't want to scare anyone. Oh, that's Dio. Going to that one with a couple of emojis of laughter. Come on, Dio, you're already scaring some people. What are you talking about? Anyway, yes, if you want to ask Dr. Uchenna Okoro some questions, 0809-444-0981 is the number to call. And I was going to ask you about diet and nutrition, and there's certain foods that some people have sworn by that helps you reduce the risk of things like prostate cancer. They said avocado, pear, and this and that, and blah blah blah. Are these fruits, are they actually really preventive, or do they actually help to prevent something like someone that's got prostate cancer? Because a lot of guys they stop by the road, avocado pear. I say, is it the in thing now? Maybe I should get myself a couple of pears.
Well, I think fruits generally are good for everyone. You don't have to be down with a particular illness for you to say, okay, I think this should be what I should be consuming now. So generally fruits are good. Avocado, pineapples, bananas, whatever you want to take, I think it's fine. But I am not sure about any of this fruit preventing any specific malignancy, because just like I explained earlier, these malignancies, we can only attach specific risk factors to them. In most cases, we do not know what are the actual causes.
Okay.
Yes, so yes, maybe some fruits, vegetables may reduce the risk, but it doesn't mean that it would prevent. Preventing means if avocado prevents prostate cancer, if I eat an avocado, I will not come down with prostate cancer regardless of whatever happens.
So it helps in
exactly. So, but if I eat an avocado, I am possibly reducing my risk of coming down with prostate cancer. So it's
it's not a thing of an avocado a day.
No. Avocado will not
drive the doctor away.
No. At least not for now. I still need to keep my job.
Okay. That being said, finally, Dr. Okoro, please tell us, how can individuals listening to the show right now contact you at Evercare?
Our listeners can get more information concerning what we've discussed by going to our website. That's www.evercare.ng, or you can call any of the hospital care numbers, 081 39850710. I'll take that again, 081 39850710. Or you can send us an email, info@evercare.ng, and you would get your response as soon as we get the email.
Okay, so he said it, and you are located where?
We're located here in Lekki at number 1 Admiralty by Bisola Durosimiechi Drive, in Lekki Phase 1.
Okay.
Yeah.
So those of you who've been listening to Dr. Uchenna Okoro, and you've had what he has said is appealed to you in one way. You see, the thing is, culturally, we men tend to act like supermen, that nothing can happen to us.
Doesn't help.
And it doesn't help. And we don't want to go to the hospital and have ourselves checked.
I wonder why.
And, because we want to be supermen. And we're men. We're men. That's always the thing that
I think men should actually come to the hospital more, because I'm not trying to sound somehow, but women are better built. So I'm not saying this as a doctor now, so no one should go to me. Women, I think they're more resilient.
I hope you heard that
more resilient.
Send some more emojis, please.
Men should go to the hospital. So.
Anyway, it's been a pleasure having you on the show.
Thank you.
And it's fun to say that. I mean, you've really touched on this subject, and wish you all the best tomorrow when you get ready for World Cancer Day.
Thank you.
As well. And that's been Smooth Health, brought to you by Evercare, and we'll be back for another edition next week, Thursday at 5:15. The Smooth Drive continues right after this.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every
of cancer.
Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.